Hi everyone. So this is a recording of a summary of the presentation that I gave to Women in Urbanism last week in mid-April 2020. And we're talking about inclusive access and what that means for the design of built environments. I'm going to talk through these slides, which are available as a downloadable PDF from this post, wherever you found this from, and from my LinkedIn page as well. So today I'm going to be talking about what inclusive access means, what I think it means, particularly with regard to transport, how we can use good engagement methods and finding people's voices to fill the gaps that I see in delivering inclusive access, some principles for design and how we can think about providing transport infrastructure and public transport services that are inclusive, and then some recommendations for more research. So when I think about what inclusive access means, this slide is summarising the variety of capabilities that humans have. So we all have strengths and weaknesses in terms of our body and our senses. We can do some things better than other people, we can do some things worse, and those capabilities vary throughout our life. So when babies are born, they're pretty useless, can't do many of these things very well. And equally, as we age and as people get older, they start to lose their capabilities. They can't do things as well as they used to. And for some people, of course, they have some kinds of permanent impairments, which mean that whatever age they happen to be, their capabilities are limited as well. And as well as capabilities, we also have variation in how we feel. And I describe that as human states. So our ability to get out and live our lives isn't just affected by our physical capabilities and our senses, it's also affected about how we're feeling and what's going on in our heads. Sometimes, for example, you might just feel really sick or unwell, and that really has a big impact on your choices, what you do in your day, and especially whether you use any transport modes and how likely you are to use them and to enjoy it. So the combination of states and capabilities affects everybody differently. That's the point of these two slides. It's to say that, yeah, there are some people who are described as disabled. There are some groups we define as relatively more capable than others, but ultimately, inclusive access means designing for everybody and all of their capabilities and all of their states, as strong or as weak as they are. When we think about who has the most limitations in their everyday life, people with disability by definition have reduced capabilities compared with other people. They're also much more likely to experience mental illness, anxiety and depression, and they're also much more likely to be tired, fatigued, and to live with pain and to be generally unwell. So generally in transport, when I think about inclusive access, talking with and understanding disability is a really direct way to know whether we're providing inclusive access or not, because if we're doing something that works for disabled people, then we've pretty much got all of those most marginalised capabilities and states covered. So if we think about that in New Zealand, what does that mean for our context? People with a disability make up 24% of our population. That's a pretty big number, 1 in 4 people. If you look at European New Zealanders or Pākehā, then most of those people with a disability are older people. More than half are aged over 40, and the highest proportion, the highest number is amongst people aged over 64. But if you look at a different ethnicity, at Māori New Zealanders, you can see from this chart that most Māori with a disability are not actually aged 64 plus. That has the highest proportion of people, but because of the difference in life expectancy, actually most Māori with a disability are younger than most European New Zealanders who have a disability. So if you see a Māori person with a disability, they're most likely to be a working age person, to be between age 15 and 64. If you see a European New Zealander with a disability, they're most likely to be an older person. So it's important when we're estimating their prevalence in the community that we understand how disability varies within population groups so that we know who we're dealing with and what that means. And that is important when we think about transport, because ethnicity and gender interact with disability to affect how much capability people have to go out and live their life. If you look, for example, at employment, there's a big difference between males and females in New Zealand in terms of how much they earn and whether they're likely to have a job or not. And those differences are most stark when you compare non-disabled males to disabled females. So these data say 75% of all males in New Zealand aged 15 plus are employed, and that proportion includes people who are of retired age. So some of those people are not working because they've retired and they don't want to. Some of them might be out of the workforce for other reasons. They might be looking after small children or caring for someone else. But that proportion is way lower. The number of disabled females employed in New Zealand, adults, is 21%. So when you consider that that includes retired people and parents and caregivers and people studying or not otherwise working, then that number is really low. So like I say, we've got access to these statistics, and it's important that we use them so that we can really work hard to justify inclusive access decisions in our work, especially for a built environment, because access to transport is one reason why there's a barrier to work and education for disabled people, for example. It just makes your life that much harder. And obviously, if you're employed, you're more likely to have a higher income, and income affects everything. It's like a cloud wrapped around all of these other capabilities and states. If you have money, then you can afford to overcome some of the challenges in your life more easily than someone who has the same challenges but who has money. So that's why, even though we're talking about transport and the built environment, considering people, their capabilities, their states, their employment status, and their income is really important to justify inclusive access design decisions, because it can, like I say, have a real impact on whether people can ultimately participate. Because the more choices you give people that don't cost them money or cost them very little, then the more likely they are to overcome the other challenges in their life. So now we're going to move on to talking about disability sector engagement. And this slide is talking all about road safety, which might seem like a big leap, but what I'm doing here is comparing how we consider inclusive access generally in transport to how we consider road safety. And in the New Zealand transport industry, road safety is a really big objective in transport policy. That means there are a lot of people working on it. It's really well understood. We have a national vision and policy just for road safety. We all learn about it in training in transport engineering and planning. And we do a lot of monitoring and research. So all of that stuff with road safety is kind of hinged on crash data. Everybody who works in transport knows about crash data. We collect a lot of information about every crash, who was involved, where it happened, the time of the day, what the severity of the outcome was, what the transport modes were used. And we can use that data to make better decisions in the future, because we know what impact our decisions have on crashes. When we think about inclusive access, it's not really as big as road safety. There isn't really that widespread understanding amongst the transport industry of what inclusive access is. And I think one of the big reasons for that is that we don't have an equivalent of crash data. So there's no central kind of number that we're trying to improve or trying to work on. So we have some policy words about inclusive access. A lot of regional council policy statements and the government policy statement will say that we want to have choices for everyone and that transport needs to meet the needs of all people. But we've got no way at the moment of measuring whether any of our efforts actually do that. So we have the best intentions, but the system compared to road safety has got a lot of holes. And that's one of the reasons that I think it doesn't attract as much attention, because it's really hard. There's no one tangible number we can point to know whether we've done any good. So I suggest that inclusive access is about equity. It's about how is transport helping everybody, who has experienced its benefits and who bears its costs. And if we can minimise the gap between haves and have-nots, then you'll have an equitable transport system. And what that means is that people who want to travel can travel, and you won't see any difference in the people out there in society compared to who lives in your community. At the moment, we don't measure what I call diversity of participation. So who is out there on the street? If you see, for example, 5 wheelchairs out of 1,000 people on the street, it's useful to know that actually that's a lot lower proportion than lives in that community. So we can use those kinds of numbers. It just takes a different approach than we've used to date. And in the absence of those numbers, this is where we get to disability sector engagement. We don't have any data about participation or whether a new raised crossing actually improves accessibility. So we need to ask the experts whether it's a good idea or not. So disability sector engagement should inform every step of this process. I'm going to go through a flowchart that I have published that can help us understand how to do that. We need to know whether our transport decision impacts on disabled people, and if it does, we need to go to the next step of, well, does it affect people generally? Is it something like a rule change in the country or a design standard change? And if in that case it affects disabled community generally all around New Zealand. And there are really good disabled persons organisations and advisors to help at that level because they understand transport jargon and rules and policy, so they can advise at that kind of level. But if inactivity in transport or the built environment is affecting an individual street or town centre or community facility, then I think it's better to go and find local disabled people to have their say on that investment. They might be able to give some tips on whether there's a quick fix, a road crossing that needs to go in, or even a curb cut needs to be fixed, or somewhere where the lighting needs to be improved to make people feel safer. And all of those inputs can help make your outcome more inclusive. So there's a difference in terms of who you might engage with, but the outcomes are to get your project or your design or your bit of infrastructure better and more inclusive. And because we don't have the numbers or the design standards to know whether we're doing that, then we need to go and find the experts who are disabled people with lived experience of disability and moving around their own community. So now moving on from engagement to design for inclusive access, and this is transport specific really. And some people will say to me that it's hard, which it is, but there are conflicts. So while some designs can be objectively more safe than others, usually because they're reducing collision speeds or the potential for collision, when it comes to access, some design features help some people and make life harder for other people. And this picture shows some yellow tactile paving, which is really essential for people who are totally blind for them to know where a road crossing is, and specifically where a hazard is. So if they're about to walk into the road, those pavers will alert them. They're also useful for people who have low vision because they can see that contrast. But they're really annoying for people who use small wheelchairs. Even if you have a child with a scooter or someone using a wheelchair, they can make the wheelchair ride or the scooter ride bumpy, they can be slippery. So in that kind of situation, it's helpful to think, well, whose journey is limited completely by this situation? And what's the kind of ultimate limit state? That's a phrase we might use in civil engineering construction to say, well, we're going to design this building for everyday use, but we're also going to design it to stand up in an earthquake. It's the same with transport. We can design a street for everyday use for able-bodied people. We can also design it for the most vulnerable person. And when it comes to crossing a road, if there's level access, then the most vulnerable person is someone who is blind. So yeah, put the tactiles in. And a way to think about design generally and whether it's accessible, there are some checklists and design standards online that you can use for specific projects, but in general terms, if you're talking about a public place or a public street, an accessible place is safe, the routes are obvious, and it has step-free choices. I'll go through each one of those. A safe street means that the collision speeds are survivable. So that means that somebody crossing the road, if a driver or a pedestrian makes a mistake, then that's not going to result in serious injury or death. So really you want 20 km/h speeds or lower. Or you want to be completely separated from traffic. So we have some situations like underpasses at train stations so that people are completely separate. It also includes feeling safe. So if somebody doesn't feel safe, then it's not an accessible place either. Universally accessible places are also obvious, and by that I mean that there is an obvious place for you to be. It's clear where pedestrians are supposed to be, where bikes should be, where cars and trucks should be, or they're obviously excluded. So we have some places where there are gates up and traffic can't go there, and that's obvious. It also means that the way through that space should be visually, tactile, and audibly obvious. So people who aren't familiar should be able to find their way through. The third principle is step-free choices. So people who use small wheels especially, but also just people who feel a bit sick or who are in pain or who have a lot of small children or who have luggage, really rely on step-free choices, and they need to be safe and obvious as well. And one example from my life where I think about these three principles was landing in Paris at the airport and negotiating my way through the metro train system and underground in the middle of Paris to my hotel, and I had luggage and heels on. So I didn't speak French. I needed to have a route that was safe because I was a woman traveling on my own and it was a bit scary. It needed to be obvious to me, even though I didn't speak French and I didn't have a phone with data or anything. And it really would have helped if it was step-free because I had luggage with wheels on it. It wasn't really any of those things, so it made it really hard and stressful, but I got there because I have an income and I have other ways to get around, so I could bail and get a taxi. But safe and obvious step-free routes, yeah, really work for everyone, and they're essential for people who don't have other choices. When it comes to public transport and system and service delivery and design, there are three other principles, and they are that transport is reliable. It gets there when it says it's going to get there and you can rely on it. It's affordable, so you can pay for it, everyone can pay for it, and it's dignified. And what we mean by dignified is kind of summed up by this quote from a research participant. And she said a lot of people with disabilities talk about their public transport journeys in a similar way. Bus drivers make or break my journey, and honestly, 90% of the time they are wonderful, but I'm always anxious about that. Sometimes they don't stop for me at all. I've had a driver refuse to put down the ramp. I told him it's my human right, and he just looked at me. I said, I'm going to complain to the Human Rights Commission, and he just shrugged and drove off, leaving me there in the rain. So that story, I think we should all do well to bear in mind when we're thinking about why dignity in public transport services is important. And it's not directly related to the built environment, but it's certainly related to the effort that we put into public transport and also how we value all of the people involved in that system, because bus drivers aren't the most highly paid people on the planet either, and their main objective from their boss is to make their route on time. So if that's the only thing they're measured on, then I'm not surprised that they sometimes leave people behind. If it's going to take an extra minute to put down a ramp and they're already a few minutes behind, then you can see how the pressures build up. So I'm not blaming bus drivers. I don't think it's just a matter of training. It's valuing everyone in that system and seeing how equipped they are to provide a dignified service. Another transport service that is reliable, affordable and dignified is community transport, which is volunteer-based transport services, and these exist all around New Zealand. I've got some links here if people are interested to learn more about that. But I think they're really undervalued as well and underutilised in New Zealand as part of our transport system, because they're like a really high value paratransit service. They work when people don't have other choices, and they can help people get to hospital or to shopping or even to community lunch events or places where people can socially interact. And a lot of those services are wheelchair accessible, and they operate on donations. So they're a really good solution to a lot of transport problems, especially in rural places, small towns, but also in urban areas where they meet a need when people don't have other choices. There's a list here of tools that we use in transport engineering sometimes. I'm going to go through them quickly. So there are different kinds of audits. We can do an audit or a review of plans for a project that hasn't happened yet, and some of those are access or inclusive access or non-motorised user audits. We can also do that kind of audit with in conjunction with a safety audit, which is a safety review of plans before a project is constructed. We could also go out and audit an existing street to see whether it's safe, obvious and step-free. And if we involve disabled people in these processes, then we can prioritise better according to the needs of local people. Community street reviews do that. They use local people of all kinds to rate streets and crossings and provide priorities for improvement. Beyond that though, if we really want to make change in the system, then I think we need more data to make this whole inclusive access objective more directly relevant to the people making decisions, because they're always comparing their investment to something that's got a benefit and a cost. If we've only got a story or stories about how access barriers make people's life difficult, then it's hard to justify shifting money around when you've got a road safety project, for example, that has very clear benefit dollars and costs. So we need to collect more data about diversity of participation and pedestrian and cycling data generally for every project to try and shift this balance to make spending on transport fair. So that's the end of that really. In terms of recommendations for more research, I hope you can tell from this talk that inclusive access has the potential to be a really huge industry. I think at least as big as road safety, and actually kind of bigger because it has overlaps with so many other areas like social science and geography and planning and law and human rights and all sorts of other things, health definitely. We don't have a lot of understanding about how to take data from those academic areas and apply it to transport investment. So there's really big opportunities to do that. Some research that you see out of universities can be really niche, and I'm sure it's interesting to some people, but there's a whole lot of practical research that can be done for inclusive access, and we can see it as soon as we're outside of our front door. If we just open our eyes, we can all work to make a more inclusive world. So in summary, I talked about 4 different areas. The first was at what is inclusive access, and it's really an equity lens to consider all of human capabilities and states for all built environment decisions. We talked about disability sector engagement, and I see that as the most direct way to get inclusive outcomes, especially now, given that we don't have a lot of data and it's not very widespread around all of our different projects. Designing for inclusive access doesn't need to be complicated if we can make sure that our projects are safe, obvious, and step-free, and that transport services are reliable, affordable, and dignified, then we will have come a long way. And in terms of recommendations for more research, if any of you out there are curious about this, just feel free to start your own search online and in your own community to see how inclusive access affects people near where you are and your friends and family. And if you'd like to talk about any more of that, then obviously I like talking, so feel free to contact me and we'll keep the conversation going. Thanks very much.
Thank you, Bridget. I have 2 questions. How much of designing for inclusivity is about designing for active modes?
A lot. It's because every journey starts and ends with walking. Cycling is important as well, especially because the better we can design for cycling, then the more premium our footpaths will be. Fewer disabled people cycle than able-bodied people, but for some disabled people, for example, cycling is huge for them. So yeah, cycling and walking are the lowest cost modes, therefore they're the most, economically accessible to people. It's really a lot of it about shifting that balance. Having said that, it's important when we think about car-free areas to remember that some people do rely on cars, especially, for example, mobility taxis. So it's about understanding a local context, I think. I think for every city or area, we should be looking at walking and cycling first in that order, because they're the most efficient ways to invest in good outcomes for transport and health. So yeah, a lot of it is about that, so long as we make those walking and cycling projects as inclusive as possible.
And maybe this is too broad, but like, what is inclusive access in competition with? Like, why doesn't it just occur anyway?
I think it is a big question, but I think the main thing is that a lot of people, when I'm talking to them anyway, revert to design standards. So they think, well, we're doing a project, therefore we will try and make it inclusive. We don't even look at it from the outset of, well, why are we doing this project in the first place? Or we don't have an activity class in our funding for inclusive access projects to kind of lift our cities up in a step change to more inclusive, to be more inclusive. It's kind of a byproduct of other projects. And I think that comes down to this lack of measuring anything, and also because it's a lot more, it's not self-contained within transport, like efficiency projects. If you want to get someone down the motorway quicker, that's all contained to the motorway. Whereas inclusive access, people think, oh, well, it's not just transport that affects someone's participation, which is 100% true. Doesn't mean we shouldn't try. But yeah, I think basically it's one of these kind of wicked problems that's got aspects and way more than just transport or built environment planning. And people just struggle to get their head around that because their jobs are usually pretty niche and in a bucket. So it's not really anyone's job to go and look at all these things in combination.
Yeah, and if the government was, or NZTA could do like one really big thing to make a difference, what would it be, do you think, in terms of?
You know, the easiest thing, the easiest next step, I think, would actually be to create an activity class for community transport. Because if you do that, then all of a sudden you're giving the community the opportunity to respond to their own solutions. So that's like a real quick win kind of thing. And that still really relies on cars and vans and that kind of travel. But if you start doing that, then all of a sudden you'll also get stories and impetus to go and look at the built environments that these people have to encounter when they're at the starts and ends of their journeys. So yeah, community transport is a really nice self-contained one-off line item that we could invest in really easily, and I feel like it would be really effective as a short-term kind of bang for buck. In the longer term, like over the next sort of decade and more, then I think we need to start collecting more data and working out the economics of accessibility so that we can tap into, you know, more revenue streams at local and national level and really justify it to the people making economic decisions.
Cool. Awesome. And this, maybe this is too hard a question, but it's like when you talk about the economics, does that almost weaken the argument? Because like I feel like we should be doing this from more of a moral standing than like economics. People say like, oh, the travel time saving, like who's bringing the money in? Yeah. You know, like they might be in the cars, if you know what I mean. Like, does the economics, do you think, supports doing more inclusive access, or like couldn't? Yeah, I vacillate. That's a new word my husband taught me. It means like I waver between thinking that economics is crucial, because if you're asking for money, you need to frame your question in economic terms, and then also thinking that economics, every bit of economics is Mickey Mouse and made up, and just there's so many assumptions involved. So if you want to play that game, then you have to do it well enough to convince people, and then you think, well, why should we have to? Because this is kind of a basic human right and we should be doing it anyway. So my usual conclusion is that we have to keep doing both things, get more stories and more statistics, because there are people who make decisions who respond to different combinations of those things. Yeah, cool, awesome. Thank you very much, Bridget, and thank you everyone for having a listening in to the Women in Urbanism webinar. Cheers.
Kia ora.